Good afternoon, ladies and gentlemen. All protocols observed. Thank you for taking the time to be here. My name is Dr. Lola Adeyemis, and I run an organization called Magna Carta Health, where we focus on preventative medicine and sustainable healthcare. So let me start by saying a quote. The world is a book, and those who do not travel read only one page. So indulge me, right? I'm going to start with asking questions. With a show of hands, can anybody tell me here, how many people were born in a hospital? Hospital. You're born in a hospital? Okay. Who was born at home here? How many people were born in transit, in a car? Oh, interesting.
Yes, you find the couple.
Okay, I was born in a car. I didn't know there were other people born in a car. But this has nothing to do with this. I just wanted to get your attention. So now that I have your attention, we can continue. So, well, the coronavirus, like everybody has said, could not have come at a better time, or a worse time actually, as regards to travel medicine and this event. And because it catalyzes the reason why all of us are here as stakeholders, we need to come together to fight this deadly disease. As of this morning, it has killed over 2,130 people. I know some people will say the flu is killing more, the malaria has definitely killed more, but it is the current public health emergency right now as we speak. And about 75,751 cases have been confirmed as of a few minutes ago. Some people say it's trending more towards a pandemic, and that is really scary. And for those of us that are here that are non-medical people, quickly, I'm going to explain what a pandemic is. A pandemic is a disease that has traversed many hemispheres, that has gone to several countries and continents. An epidemic that has gone through continents and countries. And what an epidemic is an infectious disease that has passed from quickly, an infectious disease that has quickly spread through populations. And that's basically what that is. So right now it's a public health emergency that has been declared that by the WHO. But the point is, it is a disease that we're all worried about. But travel medicine is not about coronavirus or SARS or Ebola. It is really when anybody purposefully determines or decides to leave a country to another. It's about everyday life. It's about paying attention to what Dr. Patrick has said, and Dr. Leo, and everybody else has paid attention to. That's what travel medicine is about, really. And those of us who have been, but let me go back a little bit, right? To understand the magnitude of this, in 2018, 1.4 billion people traveled internationally. 1.4 billion. As compared to 1950, where 25 million people traveled. So let that sink in. That means 1.4 billion people potentially could spread diseases, infectious disease, across the globe. 1.4 billion is 18% of the population, of the world population. Now think of their friends, their colleagues, and et cetera, et cetera. Just think of that, how fast a disease can spread. So I guess when people are scared about the coronavirus or Ebola or H1N1 or whatever, that's basically the reason why. And the thing about travel illnesses when you travel is the CDC actually estimated that 30 to 60% of people that do travel potentially come down with an illness. So it is alarming statistics that you can really fall sick when you do travel, so people need to pay more attention to it. So, as many of us know and have come to find out, diseases do not discriminate. It doesn't matter what class of travel you fly, it does not matter the palette that you have acquired, the genre of music that you listen to. What matters is that all of us are susceptible to diseases. And those of us that have been fortunate to get on a plane for one reason or the other hardly think about the health impacts of our travel, the underlying health issues that we have, or we don't take time to find out what can happen to us when we get to where we're going. What we pay attention to is it cold? Is it hot? What's the weather like? or where are the shopping malls, or what's going to happen when we get there, or what's the fun? Those that scuba dive, like what's going on there? What's the latest adventure wherever we're going? That's what we're more interested in. But we need to pay more attention, right? Even those that go for medical tourism, that are going for a health issue, what they're really concerned about is the current condition that they're going to be managed for. Let me tell you a true story. A patient went to India to manage her health condition, and she had cancer, and she was followed by someone. She had a companion, like most people do. And they got there, and they were taking care of the cancer patient, and the companion slumped. That happens, right? And unfortunately, everybody was concerned about the main patient. She did not bother to go and see, not even a travel specialist, her primary care physician prior to travel. And it led to a lot of distress, which could have been pretty much avoided if she had paid attention to herself by visiting her own primary care physician, not even a travel specialist physician. So these things really happen. So, let's talk about travel medicine in Nigeria, the journey so far, and the opportunities for the future. There's good news and there's bad news. The bad news first is that the journey in Nigeria is not far at all. It's actually very short. But the good news is that there are a lot of things that we can do about it, starting with this. This, like a lot of people have said before me, is monumental. It's a great thing that we're doing. The Nigerian Society of Travel Medicine is the start, I believe, of something great. Now, don't get me wrong, to be clear, prior to the launch of this, travel medicine has been occurring in Nigeria. And I say this because I know, but more importantly, if you do an online search of travel medicine clinics in Nigeria, you will quickly come upon Q-Life Clinic, for instance, owned by one of our trustees, Dr. Alakija. You will also find Paleon, I apologize, Dr. Anya, owned by our very own Dr. Anya, who's here. So if you know, and that's in Lagos, there are a few more outside of Lagos, but you will find that, and they've been but they're not just, and then you'll find like Nakarta Health, but they're not just travel clinics, they're travel medicine stakeholders in Nigeria. And these are people that have been actively involved in it. And there are other stakeholders, other allied health physicians, practitioners that have been involved in the travel medicine industry. And of course, Dr. Olatunji, she's also known and been very much involved in travel medicine. However, that has not been enough. Because when you ask, who are the other stakeholders, all the other enthusiasts, the supporters, and the concerned members of the public, you don't have to tell me, just ask yourself, if you think about travel medicine, if you've heard about travel medicine, and you ask what has been going on, just think about it for a minute. Nothing really, not that much. You don't have to mention it to me, just think about it. Like, what has really been going on? Not a lot, really. And some people will say that they have been waiting for the government and looking for organizations like ours. Well, I'm not throwing anybody under the bus, but a lot of that hasn't readily been available. So I will not belabor the point. We have not performed well, because it's obvious, but I'm going to move forward and say that we can do things better. Starting by one, information, education, and sensitization, which is pretty much what we're doing right now, right? So I'm going to commend the Lagos State Ministry of Health, because the Commissioner of Health is coming here, and he's going to be participating, and they're co-hosting this, as from what I heard. They're stepping up. I'm thanking the Lagos State First Lady for being a part of this, Fan, and all the other stakeholders here. I would like to thank Leo, Eric, Tulia, and Molly, Mimi, sorry, for all coming here, and every one of you for giving us what matters most, your precious time. Because without all of you, we couldn't do this. So, but it's not just coming here, it's about moving things forward, telling people, when you leave here, even with the COVID-19, stop avoiding people that look like they're Asian. People are avoiding Chinese people. Misinformation. I'm serious. Spreading fake news. People don't want to go to Asian restaurants right now. They're scared. So, yeah, we don't blame them, but that's the thing. Passing right information to the right people. So information sensitization, that's a major thing. We're not doing that. People don't know what things are about. So please pass the message forward. Another thing is surveillance and the use of technology. We're not doing that. Google developed, due to the response to the H1N1 in 2003, they developed the flu vaccine finder. Then they passed it on to Health Map, and they now have 10 adult vaccines on there. So the Health Map with the CDC and the HHSS, they have this platform where you can go and find vaccines that you need for whatever you need. We don't do anything like that. Those are things that we can do to help travel medicine, not just travel medicine, vaccine, health in Nigeria. So we need to do more surveillance. The CDC uses Twitter to track the flu. We're not using, and we don't need to build anything. So there are opportunities for surveillance that we're not paying attention to in Nigeria that I think we should pay attention to. That's what I'm saying. 3, quickly, medical tourism. We need to improve medical tourism, right? A lot of people, so people say medical tourism, we're wasting money going outside. The truth of the matter is, people go for medical tourism for various reasons. We can't stop it. We need to improve the healthcare facilities in Nigeria, yes. But while people still go outside for medical tourism, we need to standardize care. Help standardize care for providing guidelines, right? People go outside for cosmetic reasons, for instance. But when you travel alone, air travel alone has its risks. You have the risk of DVT, blood clots, etc., etc. When you add surgery, that's further risk. People that are going for the people that are going for medical tourism, and to be clear, medical tourism is not to be confused with travel medicine, which people do a lot. Medical tourism is when you seek medical care outside international borders for health reasons. Travel medicine is broader, right? So the point is, people that go for medical tourism particularly need to visit travel medicine specialists because you are at greater risk for having health issues, potential health issues, because you're going on air travel. And that in itself has concomitant risk. You have surgery, post-op, you're not supposed to travel. And it's even better for you to even try to find opportunities here, because right now a lot of people are going abroad to do cosmetic surgeries. There's something called the butterfly bum bum. I don't know if you guys have heard of that. There's a guy that does the same cosmetic surgery in Lekki, for instance. You don't have to travel, you can do it there, and then the cost of you spending an extra 7 to 10 days in Lebanon or Turkey, or wherever they're doing it here. Now, you can do it here. The point is, though, get a second opinion from a travel medicine specialist that will tell you the risks of whatever surgery you're going to do, and the other risks that you might not have been able to find out on your own. So medical tourism is a big deal. Transport tourism is another thing that I can't get into. But we, as a society, we would really do a lot if we help standardize care by providing guidelines that, okay, even if you don't see a travel medicine specialist, these are the checklists. These are the things you need to ask who you're going to see abroad for healthcare. And quickly, I'm just going to touch on training. We need to train more people on travel medicine. I know Dr. Patrick mentioned it. Train healthcare providers, train other people, train the lay public on what to learn, what to know about travel medicine. And I think I'm going to really end here. And ending, right, I'm actually going to say this, that of note, I need to mention that there are a lot of physicians and allied health professionals in Nigeria that practice travel medicine in one form or fashion or the other. But I'd like to remember Dr. Lola Adeyemis and the entire staff of Best Consultants. She and her team saved millions of lives in the fight against Ebola. She was an endocrinologist, not a travel medicine specialist, but her versatility, her depth of knowledge, and for the greater public good, she paid the ultimate price. And I'd like to thank her. And also Dr. Jide Idris, and Dr. Ogutumeni, and I think Dr. Imani Animashawa, they also helped with the fight against Ebola through the Lagos State government. And so I'd like to say thank you to them, and I thank you for listening.